Welcome to the National Organization for Rare Disorders webinar on diversity, equity, and inclusion in action, case studies from the Rare Cancer Coalition. My name is Debbie Drell, and I'm NORD's Director of Membership and your facilitator for this meeting. I would like to thank everyone for joining us today. All lines are muted except for the speakers. We have enabled closed captioning for this meeting, so feel free to access this resource in the toolbar of your Zoom browser. This meeting is being recorded and will be made available shortly after the webinar with a link distributed in our e-newsletter and on our website. This is part of NORD's monthly webinars as a benefit to our member organizations that provide rare disease community leaders like you with information, capacity building, networking, and direct access to resources. But because this topic is so important in the rare disease community, so timely and necessary, we have made this webinar open beyond our membership, and it is accessible to the community at large to help inspire all nonprofit leaders to learn more and to take action. NORD is a 37-year-old organization that is an umbrella working with nonprofit organizations. That function is out of our membership team. And so the ladies you see here on the slide are part of the membership team working for you. NORD's mission is your mission. During this meeting, an issue raised or topic discussed may prompt you to think of a question that does not always get specifically addressed within the hour. NORD's membership team is available anytime to answer your question or any question after the event is concluded. So reach out to us by emailing membership@rarediseases.org. NORD's mission is your mission. During this webinar, you'll hear a lot of elements around diversity, equity, and inclusion. Our mission is to lead the fight to improve the lives of all rare disease patients and families. We do this by supporting patients and organizations, accelerating research, providing education, disseminating information, and driving public policy. Leaders of NORD's 330 member organizations are entitled to all the resources that NORD provides, including state-level advocacy, federal policy, communications, public awareness, and more. You'll see the definition of diversity, equity, and inclusion. And for the purpose of this webinar, we're going to use the FDA and Ford Foundation's definition. We will be using the expression or the acronym DEI, which is diversity, equity, and inclusion. And we're going to talk about how our members use DEI, how we incorporate DEI to improve programming and outreach. This happened last year. Our Rare Cancer Coalition is a network of 27 organizations that are members of NORD, and we were talking about what can we do, how can we address this, how do we work collaboratively, who's already doing this work, and what can we learn from them. So the Rare Cancer Coalition, we had a ton of ideas and organizations that were already involved. And this panel is 4 people big. We usually have 3 people panels, but it's 4 people because we just had so many good examples. So we're going to try to keep track timing-wise. But DEI is very important. This is one of many conversations that we will continue to have as an organization with our members. I am a second-generation Mexican-American. I have a sister living with a rare disease. My sister was diagnosed at the age of 28, a Mexican-American woman living in a rural town in Texas with a population of less than 8,000 people. I have more Twitter followers. Because of her rural town, her gender, and her age, not only did she have the typical rare disease delay in diagnosis, she was judged, she was discriminated, and she had an even greater delay, and she nearly died she had to have seizures. Where most patients with pulmonary hypertension, they faint. She had to have multiple grand mal seizures before doctors decided to take her seriously. This is just one story in 30 million people living with rare diseases, a young woman of color. And that's my sister's story. And I share it, and I share it anytime I talk about my family's experience. We're going to be hearing stories from our community from a nonprofit perspective. As leaders, what are we doing about diversity, equity, inclusion? So let's take a moment to define diversity, equity, and inclusion. Diversity is defined as the representation of all individual attributes and identities. That's race, ethnicity, gender, disability, sexual orientation, gender identity, national origin, tribe, caste, socioeconomic status, diversity of thought, diversity of communication styles. And that is collectively this representation and individually. We believe when we prioritize diversity, we are able to help our organization, our members, and the patient communities we represent pursue their mission and goals more efficiently and effectively. And that's a definition we work towards, and it's one that we know also guides the U.S. Food and Drug Administration. Equity, FDA does not have a definition of equity, but the Ford Foundation does, and the Ford Foundation also writes more about equity in broad strokes, abstractly. So they look at equity as defined as fair treatment, equality of opportunity, equality of access to information and resources for all. And this becomes possible when we build an environment rooted in respect and dignity. And this is also responsible or possible when we take action to ensure equitable access for all communities in the rare disease space. Finally, inclusion. Inclusion refers to behaviors and actions that create a culture of belonging and a sense of value for all who participate and contribute, while at the same time understanding no one person can and should be asked to represent their entire community. So that is what we mean by diversity, equity, and inclusion. And there may be other definitions. We embrace your perspectives and are open to learning more. This is the agenda. This is the order of our speakers. We have received a lot of questions during the registration form. You know, we had 300 people registered. We got a lot of questions in the registration form, and we looked at them and we got the themes. Many of them were frequently asked the same question over and over again. So we're going to take those questions at the end. DEI is a constant journey. There really is no endpoint. These are just case studies. We will continuously work to do all that we can to strive to make the rare disease space more equitable. It starts with intention and the commitment to act to really make a difference. I want to thank our presenters who, in spite of the pandemic, when resources have been limited for their nonprofits, they continue to do work committed to DEI and to taking action. We're so thrilled that they are here today and to share their processes and learnings. So I'd like to welcome our first speaker and colleague at the VHL Alliance, Chandra Clark. Chandra, come on in.
Hi, Debbie. Good afternoon. Thank you to NORD for having us here today, and thank you to everyone that is participating in our webinar today. So my name is Chandra Clark, and I am the Executive Director of the VHL Alliance. I'll begin my presentation with sharing some information about our mission, the VHL disease, and then I'll move into the work that we are doing surrounding diversity, equity, and inclusion. The VHL Alliance is dedicated to research, education, and support to improve awareness, diagnosis, treatment, and quality of life for those affected by VHL. VHL disease is a genetic condition characterized by blood vessel tumors in up to 10 areas of the body. These tumors can be benign or cancerous. VHL disease is a disease that does not genetically discriminate. Approximately 1 in 36,000 people in every ethnic group have VHL. Many patients with VHL go undiagnosed and untreated, particularly people of color and those living in under-resourced and underserved communities. So our commitment as an organization is that we promote equity and fairness with regards to access to quality medical care. The reason why is that we understand that we must be diligent in our approach to identify and address gaps to ensure that we represent the full diversity of our patient community and work to improve diagnosis and access to regular and experimental medical care for underserved VHL patients. So currently, some of the programs and services that we offer to meet the needs of our diverse patient population include our online support groups. Our Facebook group is our most active social media platform with over 5,000 members. We offer monthly discussion calls, and those include our patient and caregiver call, our low and no vision call, and our parents of VHL blurs call. We also do an annual meeting. We offer a hope retreat for young adults, a wellness coaching program, and My VHL, which is a patient registry that we work in partnership with NORD. In regards to our programs and services, I want to highlight just a couple that really speak to the need of inclusiveness. So for example, our VHL low and no vision call really works to support our VHL patients that are dealing with physical disabilities. And then in regards to age-specific programming, our young adult retreat we really serve to engage our young adult population. As many of you know, in the rare disease space, that can often be a difficult task, but creating that age-specific programming is necessary. So although we have experienced success with currently implementing DEI into our programs and services, we know that there is a lot more that we need to do as an organization, namely supporting marginalized communities. In that, we recognize the urgency in reaching medically underserved communities and their healthcare providers to provide information about VHL. Marginalized communities can often experience many adversities, and those include a heightened sense of vulnerability due to societal and structural factors, lack of access to adequate resources, viable information, and quality care. They can often feel disconnected from the larger patient community, and oftentimes patients in marginalized communities are unable to receive specialized care on an ongoing basis. And VHL requires that patients are able to receive specialized care on an ongoing basis. So as an organization, the question that we had to ask ourselves is, how do we begin to operationalize equity? And one pathway is we look to operationalize equity is through our relationship with our clinical care centers. The VHL Alliance has established a network of centers of excellence known as clinical care centers all throughout the world. We currently have 36 clinical care centers domestically and 19 internationally. And each center has a team of specialists that are committed to providing care for VHL patients. And that care includes improving diagnosis and treatment of VHL, providing coordinated care across medical specialty, functioning as a resource center for patients and physicians who are new to VHL. They also act as a ready channel for communicating advances to other centers of expertise. And they serve as a model that can be replicated elsewhere. So this map provides a visual of how our clinical care centers are dispersed throughout the country. The circles indicate those areas that we find to be barren or lacking access of care. So as you look at this map, you can see that, again, we've had great success in the clinical care centers that we've been able to establish, but there is much work to do as we talk about addressing the need to support VHL patients in rural communities and in marginalized communities. So as we continue the conversation of how do we as an organization operationalize equity, we know that, again, our clinical care centers can serve as a pathway, and that we can look to establish clinical care centers in areas of the country that are lacking access to the expert care that VHL patients require. As an organization, we also understand that we need to expand our ability to identify undiagnosed VHL patients in marginalized populations and support them through diagnosis, treatment, and/or surveillance. Our commitment as an organization is that we need to ensure that all VHL patients have quality access to specialized care. We also recognize that we need to create a formal system that would facilitate patients and their local doctors to tap into the expertise of established VHL experts. As I mentioned at the beginning of the presentation, we do currently have programming that is tailored to meet the unique needs of our patients. However, we know that there is always more to do, and that our programming is something that we are seeking to expand. We also understand the responsibility of educating the next generation of medical professionals about VHL so that future expertise will be more accessible. And as every nonprofit that is passionate about DEI knows, that your resources and your materials must reflect diversity, equity, inclusion, and be accessible in nature. So in conclusion, as an organization, as we look to put diversity, equity, and inclusion in action, some of the steps that we are taking include, first, we understand the necessity of empowering our VHL community to use our voice. It is actually our patient community that has really helped rally behind the need to support marginalized population and to just expand our efforts so that we are at the front line saying that we have to be proponents of diversity, equity, and inclusion. As we understand the magnitude of diversity, equity, and inclusion, we know that it is an enormous task, but it begins with having courageous conversations. It takes courage to begin the conversations. It takes courage to carry those conversations on to fruition. And so with that, we are looking and working to create strong partnerships and alliances with like-minded organizations that are more experienced, senior, and versed in the space of diversity, equity, and inclusion. As an organization, we understand that we need to listen and learn, and we need training and education. And as Debbie mentioned at the beginning of this webinar, DEI is something that is ongoing. It is a journey. And so our commitment is that we understand that it is a lifelong journey. And for us to be most effective, we need the training and the education, starting with the experts. As an organization, we also understand that we need to utilize our data to assess, identify, and address gaps. And one approach that we are using is that we have created a special internship to have a patient DEI access intern that can really help us to review and assess our data and help us to map out how we can identify and address these gaps. In addition, we are also looking to implement a diversity, equity, and inclusion task force. So we understand that representation, diverse representation must be reflected amongst our staff, our board, our volunteers, and ultimately in our community. And we want to have a diversity, equity, and inclusion task force because we also know that we need the expertise and the accountability. And lastly, we understand that our passion for diversity, equity, and inclusion begins with advancing and advocating for DEI one step at a time. Thank you.
That was really wonderful, Chandra. Thank you so much. Now, I would like to turn the virtual microphone over to Carolyn Cordella, Assistant Director of Communications at the Life Raft Group. Carolyn has been working in the Life Raft Group and doing a really good job with this rare cancer community.
Thanks so much, Debbie. Good afternoon, everyone. I want to give you a small overview of the Life Raft Group and what we do there. Our mission is to enhance the survival and quality of life for people living with gastrointestinal stromal tumors, which is GIST for short. The LRG is a global nonprofit with thousands of members. We have state representatives throughout the U.S. that work with our patients and caregivers, and we collaborate with country liaisons in over 50 countries. We partner with these liaisons and their respective GIST patient organizations in order to connect patients with information and get them access to physicians throughout the world. Well, what is GIST? GIST is a cancer. It's a rare sarcoma that makes up less than 1% of all sarcomas. Roughly, there are 300 to 6,000 diagnoses of GIST per year, but that's an estimate. The true number isn't known, partially because many tumors aren't tested for KIT or PDGFRA gene mutations. Rarer subsets of GIST include pediatric, familial, SDH deficient, and genetic syndromes such as Carney triad or NF1. More often than not, GIST is misdiagnosed or there's a great delay in diagnosis. Because it is so rare, it's not the first diagnosis doctors will think of because of the vague symptoms presented are often mistaken for more common conditions until there is an emergency situation. About 85% of all GIST cases affect patients older than 50 and are equally distributed between men and women, not particular to any geography or ethnicity. The rarer subsets make up about 15% of all cases, and these patients vary from pediatric through adult. This is based on our current patient registry information. There's no known cause for GIST, though we know it begins in the specialized nerve cells in the walls of the stomach, but can also present in the small intestine, duodenum, rectum, colon, or esophagus. There's also no cure, so our goal is to ensure the best quality of life that we can for our patients, and that means access to doctors, information, and treatments. Our LRG community is very diverse, and we have many programs and services to meet their needs. Our website has intensive information about GIST, including an international section with translations of various materials into several languages. We curate one of the largest GIST patient registries in the world, populated with patients from 69 countries. This is a natural history of GIST from diagnosis to death, which is maintained by our registry staff with regular updates from patients and covers medical details, side effect data, and quality of life details. Some of the patients in this registry have lived with GIST for over 20 years. Our dedicated staff is available to GIST patients and caregivers by phone or email for support, for encouragement, for information. And our directory of GIST specialists is made up of US-based and international practitioners. We also collaborate with doctors throughout the US and the world on individual cases, through virtual tumor boards, and through our global surveillance group, which is a team of experts who consult on complex issues and support research efforts. Now, having a rare disease, as most of you know, can cause people to feel very isolated. So in addition to being available in our office, we host online support groups for caregivers and patients regularly. And we have a private email forum for our patients and caregivers. We're active on private Facebook groups. We want to support as many programs as we can that will help our community feel connected. We also provide individual GIST mentors for patients and caregivers who want that one-to-one guidance. And we host free education days at medical and academic institutions across the US. These educational presentations are recorded to provide equitable access and are often translated into other languages when possible. Our webinars address current issues in GIST and are often directed to rare subsets of GIST and to special topics, such as biomarker testing or about side effects of specific treatments. These tools and relationships, we've become a trusted resource for GIST patients and caregivers. The Womenssarcoma program is just one of the LRG's efforts to target programs for specific communities. The Womenssarcoma program debuted in the fall of 2020 and was influenced by the recent reinvigoration of STEM initiatives for girls that we observed in the educational system in the US. The actual program design was inspired by Dr. Gina D'Amato, who is a sarcoma expert from Sylvester Comprehensive Cancer Center in Miami. Dr. D'Amato would invite other women at medical conferences to informal meetings she called Women in Sarcoma. These women gathered over a meal to discuss their personal challenges and professional challenges, to share advice, to network, and to provide support and encouragement for these women for the unique issues presented by being a woman in the medical field. Next slide, please. It's interesting to consider why this specific type of encouragement and support might be necessary. While women as doctors and oncology professionals are becoming more common, they're nowhere near the norm. In ASCO's 2020 Snapshot State of Oncology Workshop, a Workforce in America, it stated that there's less than 20,000 oncology-specific professionals practicing in the United States. Only 34% of those professionals are women. It's a big gap, but maybe it doesn't sound so rare. But think of it in terms of a rare sarcoma that most oncologists never see in their practices and is most often initially misdiagnosed. The picture becomes one of the rarest of rare, especially in rural areas, since 88% of all those oncology professionals practice in urban areas. In our own database, we've so far only connected with about 100 professionals who are women for the entire country. Now, you probably think it's more important there be specialists more equitably distributed through the country than there be women specifically. And yes, that's true to a point. We need more specialists as a rare disease, but a patient's preference is also important. And in order to provide the best care for those with rare diseases, we need more diversity and choice among oncology professionals. And specifically in treating GIST, there are often anatomical and emotional concerns for female patients that might cause them to be more comfortable with a female physician. When you're discussing radical surgeries and treatments that might change your life dramatically, you might want to have that conversation with a same-sex doctor. And there is the consideration of fertility issues for some female cancer patients who might prefer a woman specialist. Our goal with this program was to highlight women in the sarcoma field who make a difference in patients' lives and to share their stories of strength and perseverance dealing with rare patients and their diseases. We also wanted to learn more about women in oncology and the challenges they face balancing careers and family life and share their expertise as powerful advocates for patients. The program was first thought of before funding even came into the picture. During COVID, we were having conversations with industry partners about creative ways to provide virtual programming for our community. In the same light, the theme of DEI was very prevalent across our country and an important focus for various stakeholders with whom we collaborate. Our board actively participated in this process and reached out to their contacts and colleagues to find sponsors. Between those sponsors and Pfizer Oncology, we were able to produce our webinars, web posts, and then an online gala. The first panel that we presented was Women in Sarcoma, Cancer Warriors, which was moderated by Dr. Gina D'Amato. It featured a panel of 8 oncology experts representing radiology, surgery, clinical and academic oncology, nursing, and social work. The discussions included who were their professional mentors, how to balance family and professional life, and why they chose sarcoma as a specialty, plus an insightful detailed look at monitoring tools in GIST, followed by Q&A with patients and caregivers. The second webinar was an opportunity for professionals to present GIST-specific cases, as well as discuss treatments and recommendations on these cases. Through these very detailed but de-identified case studies, each of the presenters provided a unique perspective on cases that had come into their clinics. It was a window for patients to see how these experts diagnose these cases and how important it is for these doctors to really see the patient as a whole person, emotionally and physically, to treat them effectively. The Womenssarcoma Gala was the big finish to the program for 2020 and was hosted by GIST patient Dr. Monica Anderson, who is an author, public speaker, and a GIST fundraiser. The gala was held in loving memory of Nikki Morales, also a GIST patient, who to us embodied strength and courage in the face of cancer and who lived her life as a true GIST warrior, fundraising and bringing awareness to this rare disease until her passing in 2019. We honored 6 women in this gala who we felt made a significant contribution to the world of sarcoma and our GIST community. We also shared several web posts that gave our members an opportunity to get to know these incredible women. There's so much that I'd like to share from our honorees, but in the interest of brevity, I want to share 2 comments that impacted me. Dr. Breland Wilkie from the University of Colorado was the recipient of the Innovative Sarcoma Leadership Award, and she shared how hard it was at first to find her voice, especially when that room has many vocal, accomplished, and opinionated men. For her, that made her stronger, and it made her more confident, and that's a good thing. Supporting others, she feels, is very important also. Dr. Lily Klug talked about how she dealt with imposter syndrome. She felt that there were gender-based microaggressions, and she doubted herself about her abilities and ambition. This is highly common in a male-dominated field. For 2021, we're going to continue featuring women oncology professionals in our webinars and educational features and connect with more women specialists to enrich our database for our patients. We feel our patients got a lot out of these programs, seeing that doctors see them as more than a disease and to be seen as a complete person, to be seen by these experts. And it's also good for them to see these experts because these might be experts that they will be consulting with. In our plan to meet patient needs, we're committed to continuing our other diversity efforts, such as identifying and increasing interactions with underrepresented patient populations that we've identified in our patient registry, as well as connecting with more local oncologists to increase awareness for GIST through collaborations, such as a mentoring program with our sarcoma experts and partnering with other collaborators to create a CME for GIST.
Carolyn, thank you so much. That was incredibly empowering for me to hear. Very happy to welcome our next speaker. We're going to move along to Susan Thornton, the Chief Executive Officer of the Cutaneous Lymphoma Foundation. Susan, welcome.
Hi, Debbie. Thanks so much for having me today. And it's really been amazing to be part of the 4 different presentations that I think are addressing different points of view and different avenues to the DEI conversation. So just a bit about us. Cutaneous lymphomas, which are a rare skin lymphoma. So we cross dermatology, hematology, and rare, which, like a lot of other rare diseases, our disease is misdiagnosed a lot of the time, and it's hard to find specialists. And our organization is dedicated to serving this patient population around the world, and similarly to many other organizations, through awareness, education, supporting research, and connecting individuals to each other, which is such a big part of what we do. So I thought I would dive quickly right into some of the challenges in our disease. We have been aware in the 22, 23 years that we've been in existence that this disease impacts those folks with skin of color differently than it does in Caucasian populations. But until recently, there really wasn't a lot of data around that. And as an organization providing our patient education programs, we have done our best to try to reach those populations. But we've noticed that they're not represented in our programs. And again, because of the misdiagnosis, it's really challenging to address these different patient populations. So again, because it's a skin lymphoma, people of color, it shows up differently. It's misdiagnosed as other kinds of problems. And the really wonderful thing in the last 2 years, one of our most recent clinical trials actually was able to capture data in this particular patient population, underserved population, so that we were able to leverage that into a new initiative. As I said, over the years, we've really tried to address and engage with particularly African-American men who are a challenging group of folks to engage with, particularly to address areas of skin issues. And we did several different kinds of programs at men's breakfasts. We connected with the church community, and we were able to do some impactful programs, but over the years, we've never been able to get much traction. We couldn't quite figure out how to best engage with this population, particularly, and it was a struggle for us until this year, actually. So given, I think, a lot of the focus, the fact that we have data, actual data now on this particular population, and the fact that there was a lot of awareness around addressing diversity and engagement with underserved populations, we were awarded a grant to specifically address this group within our disease. And we took a step back, quite frankly, and said, what's the best approach to this? There's a grant opportunity, and for us as a small, rare organization, like probably many on the call, we have a very small staff. We cover the globe because small, rare diseases are everywhere, and trying to figure out what was the best approach. So rather than us coming up with, this is the next program, this is the next initiative, we decided to take a step back. And the grant that we actually received is to begin with a landscape analysis, really looking at the needs of Black, Indigenous, and people of color within the cutaneous lymphoma community, and really asking those folks that are in our community, what would really make the most sense? How would we best serve these populations. Our objectives for this project, which we're just beginning to launch, is really to broaden the inclusion of patients and families impacted in our disease space. How do we bring them into the fold? How do we connect with them in their own communities, in their own cultures, in their own ways of navigating in the healthcare arena? And then how do we expand the awareness specifically about cutaneous lymphomas within that community? And then based on that, creating new programs and services to support the inclusion of those folks in our community. So it's really a broad brush for us. This is a first formal step in addressing what we've known to be challenges in engaging this community. The first step out of the box is really to create a diversity task force, which is guided by a professional facilitator, not by one of us on staff, because we realized that in order to fully appreciate and understand the issues surrounding our patient population in this arena, we needed to ask and we needed help. We don't have the answers. We don't have the expertise. So the exciting part is this grant has allowed us to engage with a professional facilitator who knows way more about addressing diversity than we do. And then really reaching out to our current community to do the analysis and development of the outcomes report. And then based upon that, again, as I said, creating pilot projects so that we're able to be flexible, be nimble, and create initiatives that actually have the impact that we're looking for in a thoughtful, programmatic manner so that we can then build upon those over the course of time. We also realize that, we can't, as they say, boil the ocean. We can't address every area of DEI that we would like to, and that this is just the first step in, as Chandra pointed out, a lifelong initiative to really be conscious and aware of inclusion of all the different kinds of communities in our specific disease state. And for us, starting with people of color, because we know that is an area that is really, really underserved, and the impact of the disease and the misdiagnosis and undiagnosed folks has really can make a difference. So I thought I would just leave you with, as I said, we are embarking on this endeavor ourselves. A lot remains to be seen, but some final thoughts of what we've learned in our experience of dipping our toe in and trying some different things. I think it's really important to start where you are, look at your disease community, pick that one area of diversity that could have the most impact and start there and start where you are. Be willing to take small steps. I know for us as well, we want to do everything and we want to be inclusive and do it all, but the reality is we can't. I think listening to your community, really understanding what's important to them, be willing to take some risks and know that you're probably going to fail once in a while, but learn from that and begin again and keep moving forward.
Thank you so much, Susan. I want to leave this screen on final thoughts for just a second. It's so important to know that and this isn't specifically to Susan's presentation, but if you're new to DEI and you're in the rare disease space, thank you for being here. Start where you are. Embrace learning, which you are doing right now. Small steps are better than nothing. My favorite expression is there are 2 times that when is the best time to plant a tree? 20 years ago. When is the next best time? Today, right now. This is the start for some. And for others, you have been doing this work and in the trenches for a long time. Wherever you are, give yourself the grace to be where you are and to keep moving forward. And so this slide really definitely touches me in terms of, I'm not doing enough personally. I'm not doing enough. We do what we can and we listen. And you all here listening, it's just incredibly powerful. And we're so grateful that you're here. And we're grateful that Susan and others here shared vulnerability as to where you are as an organization and to what your hopes are, and that you're in this space doing the work. So thank you, Susan, and everyone here. I'd like to turn it over to our final panelist, Danielle Leach. Danielle, thank you so much for joining us with government relations and community work. I know you have a lot to share, so thanks for joining.
Thank you. I appreciate it for the opportunity to present today. I'm excited that we were able to transfer our conversation from the Rare Cancer Coalition to this larger group to foster progress. With the vision of conquering and curing brain tumors once and for all, National Brain Tumor Society unrelentingly invests in, mobilizes, and unites our community to discover a cure, deliver effective treatments, and advocate for patients and their care partners. Our focus on defeating brain tumors to improving the quality of life of patients is powered by our partnerships across science, healthcare, policy, and business sectors. Our donors, volunteers, and advocates fuel our work to accelerate breakthroughs in brain tumor research. Much like many people on this call, this organization was created by families seeking treatments and cures for their loved ones and all those facing a brain tumor 25 years ago. Today, we are the largest patient advocacy organization in the United States, committing to curing brain tumors and improving the lives of brain tumor patients and their families. And our mission spans all types of brain tumors affecting adults and children. Next slide. We advance our mission through 3 interconnected programmatic strategies, and we call it Defeat, Connect, and Change. Our Defeat program drives and influences that best-in-class medical research to develop and deliver new and innovative treatments and potential cures to brain tumor patients as quickly as possible. Our Connect program convenes, educates, and unites the brain tumor community. And our Change program fuels the voice and the power of the brain tumor community to advocate and influence public policy. Some areas in our current DEI work that we wanted to just reflect upon before we talk about what we did in this past year. Right now, we work on, under the Defeat umbrella, the inclusion of research advocates in our processes, the placement of research advocates on relevant review committees, and our coalition work, and one coalition work in which we do active work in is the Clinical Trials Barriers Working Group. In our Connect area, we have done in the past year some educational materials adaptation, especially in the COVID environment that's changed how we work with our patient and caregiver community. We did a review of foreign language resources in the brain tumor space, and we've revamped our structure of our trainings to adapt to our community as well as the virtual environment. And one area that's not there is the personalized support and navigation seeks to ensure our equitable access to quality information and care. One interesting project that we worked on last year in collaboration with the International Brain Tumor Alliance, we were part of the drafting committee of the Brain Tumor Charter of Rights, and 90 organizations have signed on to this charter to stimulate that debate and the discussion and advocacy to work to address the inequalities across countries. And then we also, because there's some unique needs to the glioblastoma community, worked with an organization, our brain banks, on the GBM Bill of Rights and helped to promote that as well and refine those as well. And our policy agenda always has issues around equity and access and clinical trial barriers and access to care issues that we will continue to do in this coming year. We had some key opportunities and challenges as we look through the DEI lens. And one opportunity that we had is the initial baseline of our internal work has now been complete. But obviously we have ongoing work that we have to do moving forward in 2021. We have the benefit of really strong engagement of our advocacy community. So when we need there to actively listen to them, they are well engaged with us and responsive. And another opportunity this year for us is that we are going through a brand refresh and a website redesign. So it allows us to really look through that DEI lens as we craft the next generation of our website. One of the challenges is that brain tumors can strike at any age, and then there's over 130 types of brain tumors, both adult and pediatric, with varying needs and outcomes. And the wide range of side effects, cognitive, physical, and emotional for both patients and families, presents challenges in terms of how we address DEI. So this was our process, and we wanted to share with all of you what we did as an organization. We spent close to a year doing our homework, looking internally as well as externally. So we, in 2020, at the beginning of 2020, created an operational goal, a DEI operational goal. And then our HR department did an amazing job of convening a DEI working group with representation from every department from our organization, from accounting to our events team, to our development team, to our research team, to our advocacy team. It was integrated throughout all. And we were able to meet monthly and look at and review all the key issues and opportunities and propose some recommendations and a draft value, DEI value for consideration. Our report was shared with the executive team and our board, and we're actually just about to get the new DEI value approved in our next board meeting. But also as an organization to integrate the DEI vision is execution of those recommendations with SMART goals for 2021, both by department and our individual goals all have a DEI goal. So across our, take a look at this is our mission delivery. And if you look at diversity, equity, and inclusion is an underpinning of all of our work. From the policy agenda we pursue to the education and outreach we conduct, the research that we invest in, DEI is expected to be a lens through which we work as we operationalize our mission delivery. So some of the opportunities that we really have looked at in the COVID era and also in 2020 and moving into 2021 is in communications. There are many resources and recommendations for DEI sensitivity in communications, which are highly dependent on the communities you serve, whether it's website, print, mobile, apps, videos. And some easy things that we did or we are looking at as an organization as we move forward is our font size and type, the colors we use, the graphics, the increased video content and shorter video content that we are hearing that is important to our community. Closed captioning, as you see today, is very helpful for many in our community. Mobile-friendly designs actually is something that is important to many communities, as sometimes their cell phones are the primary access that they have to information. The choice of representation in photos or used stories highlighted. We did an internal implicit bias language review. We reviewed pronoun usage as an organization, and we looked at cultural competence. We have made some progress in the last year in incorporating DEI into our communications. We see that powerful opportunity in our website redesign to be innovative and sensitive to our community's diverse needs. So I wanted to give some lessons learned because I think, as others have indicated in their presentations, you have to start somewhere. But I think most importantly, you have to look at yourselves as an organization and start internally and then move externally. Consult the community you serve, the experts in the area of DEI, and organizations that work in that space. Involve your whole organization from your boards all the way down to your volunteers. Creating SMART goals, that is incredibly important so that you have achievable, time-bound goals that you can see the progress of your work. And communicate that process and communicate the trajectory that you are on. Engage those external stakeholders. And as somebody mentioned before, that landscape analysis is really critical, not only to understand the needs of the community, but also to really prevent reinventing the wheel. There's a lot of great resources out there and organizations that are working on these issues, and it's an incredible opportunity to build partnerships. Thanks.
Thank you so much, Danielle. This was a lot of information. We had some incredible speakers. We're actually juggling doing Q&A through the Q&A function. 300 people registered for this webinar, and we actually got more than 300 questions. Some individuals put in like 5 questions. That said, we looked at them, we categorized them, and there were some common themes. So the first question that I'm going to ask, and unmute your line, ladies, if this question resonates with you and you have feedback. Question 1, how do you recruit diverse leadership for your board and staff?
We've been lucky over the years to have been able to have a pretty diverse staff. I think it wasn't something that we did on purpose, but we were very fortunate, which has been great. I will say it's a big topic of conversation and something we're working on now with our board. And one of the things that we've done recently, we're just getting this off the ground, is we're building a board advisory council, which is an adjunct group of previous board members and some new people so that we can engage with folks. And I'm hoping that we'll be able to bring a diverse group of people that we can then engage with us, have them get to know the foundation, interact with us, and then kind of build that bench to the board with a focus on diversity. But it's a bit of a challenge, I think.
For us at National Brain Tumor Society, we had a board committee that looks at board recruitment under that lens and other areas around the organization. Our HR department has, in pursuit of this goal of DEI goal in 2020, especially looked at our practices, hiring practices, and across the organization, the trends across the organization, our employee surveys, active listening to our employees, but also just, looking at our job descriptions and, implicit bias in our job descriptions and how we post jobs and the language that we use or where we place jobs for recruitment, are simple ways in which we are taking a look at reducing those barriers.
Thank you. Carolyn?
I think at the LRG, we've been very blessed because we're in such a diverse area and with a couple of really large universities nearby. So we've been able to hire a staff that's 80% women, a lot of master's degrees, and a lot of diversity. So that's been that's been a gem for us. That's really worked. And as far as board, we're pursuing. That's a little harder. And, I really appreciate hearing the comments from other people. That's a little harder to find board members that get a little more diverse, but we are working on that.
Yeah, and I just want to chime in here, Debbie, kind of what Susan said. We're just starting to have those conversations. So I would say we're more in the infancy stages, scratching the surface, but understanding that it's necessary. I think one of the most powerful things that we've been able to do thus far is to put the word out that is a desire of ours and is something that we recognize that we need to move towards. And that also presents opportunities to have those conversations because, as Carolyn mentioned, especially in regards to the board, it is a little bit difficult, but I think we all agree that it starts with the courage to put that information out there and to begin to have those conversations and even address that it may not currently be reflected, but it will be in the future.
Thank you, Chandra. And to all of our panelists, we are 3 minutes of the hour. I'm going to say the questions that were asked, the themes, only so that you all know that this is just one of many conversations that NORD will have with our leaders. It may be different leaders that you see on the screen. You may be watching a recording because you don't make the actual webinar and we do it in the future. It may be a smaller group session that we host, but here are the questions. Once I ask these questions, if we hit the hour, we might have to say goodbye to some of our panelists. So thank you so much for joining us. If you have a hard stop at 3, to our audience as well. But we have a couple of announcements. One of them is a funding opportunity, possibly hundreds of thousands of dollars for organizations doing DEI in addressing gaps in diagnosis. So wait till the end because we'll make a quick announcement about this opportunity. So the additional questions, we won't get to today, but we will hopefully down the road. What are strategies to increase buy-in from stakeholders and decision makers who may not see that there are issues within the organization? It's a tough one, but we're going to chew on this. For small organizations, do you see a value in investing in outside expertise to improve DEI efforts? The next one, how are other organizations using current patient data to drive DEI needs? What do you do when data on demographics and equitable access is not available? And then the last one is, how do you measure success? So those are the themes of questions. We're going to do our last set of announcements in this last minute that we have. So please join us on Thursday, the 25th. That link is not easy to type, but if you visit our website and go to the events calendar, click on February 25th and you'll see it there. The Chan Zuckerberg Initiative announces round 2 for their Rare as One funding. It's a grant program that gives, in the first round, millions of dollars to 30 rare disease nonprofit organizations to help them with research and working with medical communities to advance research. This second iteration is for organizations looking specifically to address diagnosis-related research challenges. They encourage applications from women, people of color, leaders representing disease areas that are disproportionately impact low income or communities of color. They just made the announcement yesterday. We really wanted to turn it over to all of you to let you know that. And I would just visit their website for more information. Thank you so much for joining us. Thank you to our panelists. We hope you have a wonderful rest of your day. Thank you for being here, for listening, and for sharing. And we will see you at a future webinar. Thanks so much and take care, everybody.